But in this case, for hypertension, you may start having some vision loss. Erectile dysfunction in men is very, very common, and one of the first signs of blood pressure, high blood pressure.
Hello, viewers. Welcome to Ezra Wellness, where you learn proven ways to healthy living. I'm very excited today because I have Dr. Xochitl Cortez-Gonzalez with me today. And today we have a very interesting topic. Dr. Xochitl is a clinical pharmacist with over 13 years experience in clinical pharmacy, and she's also have over 20 years experience in clinical research. She's also a functional medicine pharmacist. And I love this woman because she loves women's health, and that is where my heart is. So anytime that I see her, it's a joy. Today, we are talking about a very interesting topic. Hello, Dr. Xochitl. Welcome to Ezra Wellness.
Hi, thank you for having me.
Yeah, thank you. Thank you for coming one more time. Today, viewers, we are digging into high blood pressure and how to manage it functionally. We know that a lot of people out there I get a lot of messages to say, I have high blood pressure, what do I do? I have high blood pressure, what do I do? So today I called Dr. Xochitl so that we could talk about this very important, and that is affecting a lot of people. So before we even kick it off, what I want to say is that we are not doctors, and we are not telling you to come off your blood pressure medication. What we are doing is that we are educating. We want you to be aware of what could cause this high blood pressure. And if you don't have it yet, you know how to prevent it. And if you have it, these are some things that you could do in addition to your medication taken, and you and your doctor could work on it together. Okay, Dr. Xochitl, the first question is, what is blood pressure?
Okay.
Because you know, it's very,
Of course. And so it's a very technical way to measure what is the strength of the pressure that exerts your heart into the vessels every time it pumps. So if you remember, whenever they have measured your blood pressure, there's two numbers that they give you. One is the systolic blood pressure, and the other one is diastolic blood pressure. The systolic blood pressure is exactly when your heart, that is the pump that keeps all the blood circulating in your body, it pumps and exerts that pressure to push it through all the vessels. That will be your systolic. And the diastolic is when the muscle of the heart relaxes and it builds up that pressure of kind of return almost. The second measurement is sometimes even more important than the first pressure of the heart pushing through the vessels. And that is blood pressure as it is. And we have parameters. And normally when a normal blood pressure will be below 120/80.
Okay. So that is the pressure that the heart is exerting against the vessels once it pumps.
Correct.
Yeah. Yeah. And then you all know that normally they write in the number and they write a slash and they write it over. So that is what she's explaining over there. So Dr. Xochitl, I know you talk about the numbers, but how do we normally measure it? There is so many different ways they measure blood pressure, you know, some on the arm, some on the wrist. There are differences in those, the way they measure it?
Yeah, so first of all, your blood pressure can vary through the day, even in the way that let's say that you're coming out of a run, or you walked very fast and you sat down and you just measure your blood pressure. May be very different if you're just sitting down, either watching TV or doing one of your favorite hobbies with your hands. If you're more relaxed, even stress can alter the way that these numbers are. So in order for you to have an accurate reading, of course, it's always with your doctor, with the cuff in your arm. There's other devices that now they exist, which is in your wrist. And it's good when you want to keep a record of what your blood pressure is. However, it wouldn't be, let's say if you have one of those cuffs or if you have one of those devices that are sold on internet, that is not this one and the cuff. I think this one is the most accurate. I would suggest you cannot be diagnosed with either high blood pressure or what I suggest is that when you go to your doctor, you remember that number that they give you when you sit down. Now, if you rush into the doctor and you're having a bad day, it's not just one blood pressure measurement that will determine whether if you have high blood pressure or what your numbers is the consistency. Let's say that you have gone to the doctor over this, I don't know, over a year for 2 times or 3 times, but your blood pressure keeps being either high, meaning above this 120/80/80, or if it's always within the number, then that will be more representative of what is your true blood pressure. But it's important that you understand and you know what numbers do you normally fall into it.
Yeah, right. So then that's very simple. What I would say is that these days, I know because of COVID, I don't think they have it anymore. They used to have a blood pressure cuff at the pharmacy where you could go and put your arm in it. These days, I'm not sure with COVID, but those are ways that we could check our blood. And I know most of us, we work in healthcare. When you are at work and relax, let your friends check your blood pressure. So at least you have a record of it, especially the one that is on the arm. So you know your numbers. That is very important. Okay, Dr.
I was just gonna say that it's important if you that the cuff that they use, or if you have a cuff in your house, that if you're a very skinny person, nothing wrong with not having biceps or anything, but if you have a small, or if you're taking the blood pressure of a child, you need to use a cuff that is a special for smaller arms, because sometimes so the cuff, what it does is it puts some pressure in your arm almost to, you know, stop the blood. Actually, what it does is stop the blood circulation, so we get the body, the heart to pump that first, you know, pump the blood through it, so we get that measure first, and then we get the second measure when it's resting, because it's like boom, that's the next little beat or sound that we hear if you're a nurse and you know how to, you know, measure blood pressure. But it's important that they have a cuff that will be appropriate for the size of your arm. And that also goes with someone that is obese. If you have a very big arm, and the cuff does not cover your entire arm, then it's not gonna do an accurate reading. So it's important.
Good. So the cuff size is very important. Make sure that you have the correct size that fits your arm. That is why your doctor's office is always the good place to check it, because they always have different cuffs and they know how to measure to make sure that you have the correct one. So Dr. Xochitl, now that we know how to measure it, are there any signs and symptoms for high blood pressure? Because I know it's normally called a silent killer. You don't have any signs and symptoms, but is there anything at all sometimes that you would know?
Yeah, so unfortunately, you don't have much symptoms, and moreover, when it starts getting elevated. So that's why it's important to know your numbers and get your checkup once in a while. There is a couple of symptoms that start coming up, but sometimes we don't relate them to blood pressure. Similar to diabetes, diabetes is also a silent killer. It's a silent disease. You don't really know that you have high blood sugar until you start having actually problems with your organs, with your kidneys, or there's poor, you know, healing in your wounds. But in this case, for hypertension, you may start having some vision loss. Erectile dysfunction in men is very, very common, and one of the first signs of blood pressure, high blood pressure. And of course, there's a lot of consequences once this high blood pressure does not get in control. And I don't know if you want me to talk about what the consequences of not an untreated and not supervised blood pressure that gets too elevated.
Okay, now that you're talking about the symptom, I think you could go a little bit in there. So the men who are watching us, if you have ED, Dr. Xochitl, you want to talk about that a little bit? Because normally the onset of it, and people think, oh, it's just that I can't get this, I can't get that, they're going for something. You want to talk a little bit about that before we move on?
Yes, so even in the clinic, when we see men coming in with just picking up medication, or just not even thinking that they may have hypertension, it's always a good question to ask ourselves, even our members in the family, oh, sir, do you have erectile dysfunction? Like, do you actually have issues there? If there's any issues there, most of the time it's because there's poor circulation. So in order for the penis to be erected, there needs to be a good, strong flow of blood, meaning the circulation, the system, the vasculature needs to be in perfect shape and form so the blood can go into the member. So the problem with that is that the patients, sometimes they just think is, oh, I may just need to have a Viagra or the famous blue pill, or I may need to just get medicated so I can get my erection on. And that is not the cause of the problem. I invite any man watching this to really look what is causing the problem. Now, we're not going to get into details about ED or erectile dysfunction because there's probably some other issues, even psychological. But in this case, for the purpose of this talk, hypertension could be one of the main causes of erectile dysfunction, and it needs to be checked out. And one of the main things is just check your blood pressure.
That's it. That is that simple. Just check the blood pressure before you go for anything else. We are not saying that you cannot try medication. You could, but make sure your blood pressure is fine before you go take anything, to make sure if there's problem going on, you deal with the underlying cause. Yeah, that's good. So then let's talk about the consequences. Now that you talk about ED is one of them, then what else if we don't treat our blood pressure?
Yeah, so the problem is that this blood pressure can continue to be elevated. So it puts so much pressure in the small vasculature in the vessels. And if you can just imagine your brain or your kidneys, they filtrate, like the kidneys, for instance, their job is to filtrate the blood and then produce the urine. So there's very small vessels. So the more pressure is built up, the easier it is for this blood vessels to break and to cause hemorrhages and to cause atrophy in the actual organ. So in the case for the brain, for instance, you can have a stroke. A stroke can be hemorrhagic or it could be no hemorrhage, but it is, imagine that there's no blood supply for a period of time in your brain due to this vasculature being broken or atrophied due to the very intense or elevated blood pressure. So that will cause that you become paraplegic, you can't talk. Brain cannot be without blood supply to function. You may have heard of just brain damage because they either stopped breathing for a while, there was no oxygen, no blood going in with oxygen, but also you have heard of someone drowning, and if their heart stops and their breathing stops and there's no blood. So similarly, you can cause a big damage in your brain, and that can be a paralyzing part of your body. It could end up in so many horrible consequences that will make you dependent on healthcare and some other stuff. So the other issue that could happen, or consequence, will be a heart attack, chronic heart failure, that you will not only depend on much more medications than just maybe a simple pill for your high blood pressure, but in many other ones that will cause, if you stop taking it, you can actually have what is called like a full-blown heart attack. Your heart itself starts being broken and the muscle doesn't work as it should. And not only that, you start losing your vision, because remember, you just imagine the little vessels that irrigate into your eyes. It will also cause issues with your eyesight. It will cause issues with your kidneys, as I said. Erectile dysfunction is a big one. And ultimately, it can also cause memory loss because your brain does not have all that irrigation. So it's not a good picture.
Yeah. Wow. Viewers, if you're listening to us, we're talking about high blood pressure and its consequences. And like Dr. Xochitl is saying, she's mentioned every single organ, from your head to your heart, your kidneys, then in the blood vessels in your legs, everything. It's a whole lot. And we could do something about this whilst we know our numbers and see simple precautions we could take so that it doesn't get us to this point. So Dr. Xochitl, now we know the consequences of high blood pressure. What causes high blood pressure?
Yeah, good question. Very good question. So there's mainly two types of hypertension. One is the essential or primary hypertension, and the other one is secondary. The secondary, I'm not going to talk too much about it because most of your audience, they will understand that if they have a disease that could cause a hypertension, well, they will, I mean, it is secondary hypertension is like when you have adrenal disease, thyroid disease, you may even have kidney problems, and that will be the underlying issue for having hypertension, okay? But in the case of our purpose of how can you take control of your wellness is the primary and essential hypertension can be caused by lifestyle, by your environment. What does that mean? If you're a sedentary person and don't exercise, you could be at more risk of hypertension. Another cause of hypertension, this type of hypertension, will be smoking. Smoking can damage your vasculature. So your vessels, blood vessels, need to be stretchy. So every time your heart pumps, that blood comes in and stretches that vessel, and then the vessel relaxes. So if this is broken by smoking too much, because smoke can start hardening, like it makes your vessels hard, they don't stretch, and eventually some of those, they start breaking. Just like if you have an old balloon and you try to blow on it, or if you have some elastic band and it starts breaking down, you will see that it won't stretch back. It would just stay where it is or break, literally break. And that's what start happening with excess, with just smoking. Smoking is extremely bad. Obesity will be another big cause, because your body and your heart needs to work so much harder to keep the supply going for someone that in a larger frame. And most of our obese patients or people will be also not too mobile because they cannot move as much with their, with that weight. So exercise gets compromised, and sedentary probably is there when someone is obese. Now, there is higher risk as we age to develop hypertension just because of the tear and wear of our body. So over age 50 or so, you have a higher risk of hypertension. But of course, if you put on together your diet being not, good or not healthy, and sedentary, then you're increasing your chances even more.
Wow, wow, wow. So now we know blood pressure could be two causes. Secondary, that means something else has to cause it. But in this video, like you said, we're focusing on the primary one that we could do something about. And that's a long list. Obesity is always showing up everywhere.
Diabetes.
Wow. So now,
I forgot about diabetes. Diabetes is very important. If you're already diabetic, make sure that you control that blood glucose, that you are a controlled diabetic person, because one of the first consequences of diabetes when it's not controlled is that you will develop hypertension. And the best thing to do is just keep your numbers down for that blood glucose.
Good. So Dr. Xochitl, now let's we looked at the consequences of high blood pressure, what causes it. How can we manage it functionally? Is there something that we could do?
First of all, know your numbers, right? So when it's getting a little elevated, and start, of course, if you just have elevated blood pressure, you probably will be better off of doing just changes in your lifestyle. If you have very, very high blood pressure, to the point if it's over 140 over 90, and your doctor will tell you when it's too high, they probably will give you medication. I suggest, and we're not doctors, but we suggest that you take your medication as your doctor prescribed, bring the numbers down, along with changing your lifestyle and your diet and the true cause of the problem. So the first thing you want to do is bring down the numbers. I can't stress that enough. If you have a very high blood pressure, you need to, unfortunately, for those that want to keep very natural, because I know some of us don't want to take medication, you want to bring those numbers down because they could damage your organs very much. I already explained the eyes, I explained the stroke. So you need to bring those numbers down. Once those numbers are down, you can do so much for your lifestyle. And I know Salome has a lot of material that she has put out to help you control that hypertension and, or more of it, the cause of the problem. So what would you do? The first thing you want to do, obviously, if your doctor tells you that it's okay, exercise. If you're a sedentary person, if you're not exercising, it's so important that you do something, and you can commit like 20 minutes a day, 30 minutes a day, however you can fit in your schedule, and whatever exercise at this point that it works with you. Because a lot of the time we become very ambitious and you want to do what someone told you is the best exercise, like swimming, but let's say you don't even have a swimming pool around your area. So
oh, you don't know how to swim.
you don't know how to swim. Yeah, that's a good one. You just don't want to set yourself for failure. I want you to set you up for success. If all you got is you have a pet or a dog that you need to walk around the block, put a timer and start walking around the block at least for 15-20 minutes, and then start adding a little more. Maybe add some elastic resistant bands so you can start doing some kind of exercise. Whatever exercise program that you do will be great. But let's say that you already walk, but you still have a hypertension. There is a study that just came up that they actually looked at different types of exercises that you can do. And I'm not talking about whether if they did swimming or they did taekwondo or they did kickboxing. It's more about do you do a high intensity exercise versus a non-high intensity? What type of exercise I'm talking about with high intensity is the one that makes your heart exert a little, higher pumps or beating. When you go, oh my God, I'm actually losing my breath, almost, not to pass out, but you understand what I'm saying. If you do some sprints, it seems like if you do at least 3 times a week with high intensity workout for 20 minutes, those 3 times a week, you start seeing a decrease on chronic disease, not only hypertension, but diabetes as well. You start seeing good numbers coming down almost by 50%, like better. Just doing this 3 high intensity. They compared it with just walking the dog, unfortunately, around the block, because there's so I want you to imagine and think that your heart, it's a muscle, just like the muscle of your biceps, right? But this, well, not exactly, but it's similar. But this muscle does not rest, right? It has been beating since you were inside the womb of your mother. And it won't until we go to what you think we're going to go after death.
That's it.
Exactly. But this muscle, it's used to just pump, pump, pump. The only way that can get extra exercise if you challenge the heart muscle to go a little harder.
Oh, yeah.
So it starts getting fitter and fitter and fitter. Okay. So if you can do, even if it's like some squats very fast, if that, your body permits, allows that, or maybe a little sprint, like a 20-second sprint, and you let your heart go up and then just let it rest, and then you do it again, and then at least 4 or 5 cycles. And there's a lot of programs, and maybe even Salome can come up with a video about how to do an easy workout that you can actually have those benefits, and you can do a challenge with that. Because at the end, you only need 20 minutes 3 times a week, at least based on the study they did.
That's great.
Exercise is a big one. Healthy diet. Healthy diet is just so broad. Like some people say, well, I eat potatoes and that's healthy because it's a
Because
vegetable.
it's not processed. I'm eating the real potato.
Exactly. So the main thing is stop processed food.
That's
Stop
it.
and I'm pretty sure everybody has heard that if you have high blood pressure, you should reduce your salt intake. So let me give you bad news. Most of the foods, the processed food, the ones that you put in the microwave and they're so practical, and must anything that comes in a package like potato chips, all of them have very high amounts of salt, and not and what I call not the good salt, because
Yeah.
when you use maybe sea salt, it has some other minerals that is not just sodium chloride. That is what you want to reduce in your diet. It seems like there is a correlation with high salt intake with how high your blood pressure is. And it's not set in stone, but what I normally recommend is to just don't stop eating salt altogether, because we also need salt. I mean, our body is made with sodium.
When you are eating healthy sources of salt.
Exactly. And Salome could probably have some more information about that, but I normally might prefer salts. I mean, I vary it. I do sea salt. I do Himalayan salt. I
Yeah.
kind of switch it,
Static
around.
salt. There's so many different kinds of salts out there.
Exactly. And but one of the main things is that most of the processed food, I would say 99.9% of them are very high and processed salt. Like
That's it. Just the sodium chloride, which is not great.
exactly, just pure sodium chloride, okay, synthetic. And then the other important thing is no fried food. I know we love those French fries.
Vegetable oil.
Exactly. Vegetable oil in high temperatures causes lots of rancid fat that becomes free radicals, that they go, when you eat them, they go into your vessels and it starts making little injuries. And this is unfortunately something that we don't, I don't think we should see it in the news all the time, that we need to stop,
Well,
but no one talks about it. But the thing,
no.
yeah, I know. So we need to have you stop eating fried food, moreover, like stop those canola oils, the corn oils, the vegetable oils that people like to fry stuff on. Just do healthy fats, like start having some fish in your diet. That's very important. Good source of omegas 3s that are anti-inflammatory. And unfortunately, all the oils that I just mentioned, the bad ones, the vegetable oils, are full of the omega-6s that are pro-inflammatory. That means that cause more inflammation. So remember, the hypertension, the hardening of the arteries and your vessels, and the non-functioning of, let's say, your tubing, the circulatory system, it also is determined by how lubricated, if you went, how well the passage goes through. So the more in your diet that you put of free radicals, stuff, gooey stuff, literally the gooey stuff that gets into your vessels is exactly coming from fried foods and vegetable oils. And a lot of the times they're hidden. Like where would it be hidden? When you look in your processed food, let's say you that dinner that you're going to have in your microwave, I invite you to flip it around and look at every single ingredient, the ones that they don't want you probably to read because they're tiny little, letters. Just read all. If you see saturated or unsaturated, whatever oil,
Trans fat, hydrogenated.
hydrogenated fat, cotton oil. Sometimes they put all kinds of oil, corn oil, canola oil. And then we don't want to talk about GMO, but in this case, I just want to make sure that you guys are always on the lookout for the extra fat that is not good for your arteries. And then if you can supplement, and we're going to talk maybe a little bit into supplementation, but fish oil is a good one. Stress management, I can't talk enough. whatever it is that is going on in your life, and we know nowadays we don't have easy lives, and
Oh
I think
boy, so much
it's
stress. It's very tough for people.
very stressful that it's not just your like taking care of the kids. I mean, now it's like the COVID situation is like, are you going to have a job tomorrow? It's so many different sources of stress. So stress can increase your blood pressure just by naturally, because it is a increasing the blood pressure and our heart beating. It's like a natural way of us to adapt to a high stressful situation. Like imagine it's your fight and flight response. Like if you see a lion, you don't want to just be relaxed watching the lion coming after you.
You have to run.
Exactly. We have to run. So the body is designed to just move as fast as it can when the lion chases you. So, but unfortunately, now our stress level is like if we have a lion 24/7 in our lives, and we can just manage that level of stress, your body eventually gives in. What I suggest and what I do myself is just try to use any technique that helps you manage that stress. It could be, for many people, is prayer, for other people is meditation, for other people is walking in nature. And a big major plus of exercising is that you need to walk outside. You need to go outside, probably your house, if that is an option. Go to a park. Try to find a way to be in nature and control that stress, because for sure it's one of the major causes. Sleep is just beyond, I think, is the big elephant in the closet. Not many people,
It is.
not many people talk about it. They think
You
it's
don't, because sleeping is not cool. You cannot do anything when you're sleeping,
right.
but it's so important.
And they kind of go together with stress and sleep,
Yeah,
because you're anxious, you're just thinking, well, am I going to have enough money to pay my mortgage or my house tomorrow? Am I going to, so all this keeping you from awake at night sometimes, or maybe you just can't concile sleep for many other reasons. And I'm sure Salme will do a segment about sleep and the future if she doesn't have one already, because
I do have one already.
right? Yeah, the sleep hygiene is so important that
Yeah,
you stop all the electronics. As soon as it's dark, try to I don't want to instigate people to start going back into do candlelight, but try to have dim lights in the house once it's dark. And you don't need a stadium type of lighting to have dinner. You don't have or whatever it is that you do entertain. And also don't watch too many news and the regular
dress yourself
TV.
up.
Exactly. I mean, I always found it funny. I come from a Mexican family, and my grandma used to love watching all the soap operas. And I said, well, don't you have enough stress in your life that you want to incorporate more stress for other people and drama? It's like, try not to watch something that gets you stressed at night.
Wow.
Try to read a book that makes you more in peace, that gives you the tools to get you better off, instead of like getting you more worried. Maybe not a good time to read the news if you are still
Yeah,
watching news, or maybe not the best time to read something that will make you and bring you down.
yeah.
So sleep is very important. Sleep apnea, that is now considered a disease. When you snore too much and you cannot breathe, and the lack of breathing or not being able to breathe makes you wake up at night without you even realizing it or not. And there is places where they can do sleep studies that is not very comfortable, but I suggest, if your partner or someone has told you that you snore way too much, and that they have seen you that you kind of like almost
Okay.
suffocate, I invite you to do a sleep study. And unfortunately, those machines for sleep apnea are not comfortable. They haven't made anything very comfortable yet.
I guess because they don't want a lot of people to get it. Sleep apnea.
Yeah, but it is, I even see it in the benefits for any other disease. Like I see
Yeah.
patients that that come into the hospital, and they understand that they have sleep apnea, and they bring their machines with them so they can sleep well in the hospital, so they can recover faster. But with a lack of sleep and not a continuous sleep through the night, it's just gonna make you not only have a high blood pressure, but it will have other type of diseases, and you don't want to go into that. And now I don't want to, we can talk about another time about sleep aids. It's not the best to get you into medication for sleep. A lot of people think that's the what is it, the symptom that they need to mitigate so they can go to sleep. But that you need to always try to look for the cause. What's keeping me up? Why I can't consult? Why do I wake up and I start just, is it your head? You need to go and get therapy. There's nothing wrong with going to a psychologist and talk about your stuff. They may give you tools, and it's good to talk about what, it's one with that. Exactly. So it could be a support group. It could be so many different things that you can do. So yeah, that's about sleep.
Okay. All right, Dr. Xochitl, we're almost at the end. And what I would say is there any supplement that I know we're not a doctor, you're not prescribing, but you recommend that people take? And all the time on, I say that if you happen to take any supplement when you're going to your appointment, let your doctor know that you wanted to take these supplements. And these days, the doctors are really in agreement with most of the supplements.
Absolutely.
Once we tell them about it. Yeah. So is there any supplement that you recommend?
So my first recommendation will be fish oil, omega-3s, a good quality one. And some may have a lot of, options for you. And the other one is magnesium. So magnesium is very important for not only any muscle functioning in your body, for your heart, for your vessels, and even for the muscle to make your arm move and your legs move. Unfortunately, our diet is very deficient in magnesium, and we really lack of it. Like I would say, I think the last time that I read some statistics, it was like over 80% of Americans are deficient in magnesium.
Yeah, and then one study also says that it's one of the number one cause of insomnia, the lack of sleep because of the low magnesium.
Absolutely, absolutely. And actually what I recommend, and of course we're not doctors, but what I recommend is that you do your supplementation of magnesium at night, because it will make you more relaxed as well, and you'll probably concile sleep better. And of course, fresh fruit and vegetables, like any other kind, will be rich in not only just magnesium, but other nutrients. But for sure, I supplement myself every day. I don't have hypertension or, heart disease, but thank God. But I would, I really work on getting my magnesium supplementation, because even if I eat organic and I eat a healthy diet, our soils, and this is something you can investigate yourself, that our soil is very depleted in a lot of the nutrients. So not having, how to say it, not having, even if you eat a very healthy diet, may not supply the sufficient magnesium you may need in order to have a proper functioning in your body.
Okay. Dr. Xochitl, the last question before you go is that, since you talk about magnesium, so can somebody overdose on magnesium? Like, can you take too much of it? I think the only side effect I know was it could pull a lot of fluid, diarrhea.
So they can make, depending on the shape or form of magnesium that you take, one of the main side effects that you will see when you do a little too much will be diarrhea. But depending on the form, right? If it's a magnesium citrate or one of those. But what I normally just caution is our patients that may have kidney disease. If you already have a kidney disease that has been diagnosed, just be very careful and what type of supplements. They're actually, for someone that has already like a chronic kidney disease, there is a special vitamins for you. It's literally like a renal type of vitamin that's called, or a kidney type of vitamin. And normally we don't supplement with too much magnesium when someone has kidney problems, because they, as you may just imagine, the kidney filtrates the blood, right? So if there's too much of certain minerals, they will start building up because they cannot filtrate, they cannot urinate, put it in the urine as much as efficiently. So one of those minerals that can be building up will be magnesium. Phosphorus is another one, and it's a major culprit of some, side, I would say, more disease on the chronic kidney disease patients.
Yeah.
So yes, I would say in that type of patient, they need to be very careful. Yes, in general, magnesium should be pretty noble type of supplementation, but I wouldn't do more than, I don't know, a gram a day. And of course, check your levels. If you ever go to the doctor, get some lab work done.
Yay. All right. Well, viewers, now you heard. We talked about hypertension today and how you could manage it functionally. Dr. Xochitl, thank you so much for your time. And as we've all heard, if you do not treat high blood pressure, the consequences is ugly. You don't want any of that. So please, let's get it under control before we get a stroke and become disabled, only because we did not check our blood pressure. Don't think that you're young, so you don't need to check it. These days, because of the way we eat, it doesn't matter. Even younger people could get high blood pressure. So if you have any issues, please get it checked out. What would you say your last words before viewers go?
I really recommend, if you're a smoker, even if it's just, one cigarette a day and you think you're not really depending on the smoking, just stop smoking. Alcohol abuse, it's a big culprit of hypertension, so please slow down on that alcohol drinking. If there's any benefit of drinking alcohol, maybe just one little glass, a cup of wine, and not every single day. And you can read more if you have questions. This video is just to keep you just maybe motivated, and that you can actually have control in this disease as hypertension, that there is something you can do that is not just taking the medication, that you can actually make this hypertension the cause of the problem. That could be the cause of many other diseases, not just hypertension, like as we explained before, is sleep and the lifestyle and the diet. If you keep that exercise going, it's not just hypertension that you're not going to probably encounter in your life. It may be many other diseases. So it's almost like so easy just to maybe just work on those core foundation of your health: lifestyle, exercise, stress management, good diet. And if you do supplementation, just know which supplements, good quality supplements, so you can actually prevent not only hypertension, but many other diseases.
That's right.
So I really invite you to keep learning, and I hope that this video motivates you to take control and do just few things here and there that you can change right now, that you have the control, and that will prevent not only hypertension, but many other diseases. So it's been a pleasure being with you. And you do start taking a little decision every morning when you wake up to make your health and your life a better one.
That's right. Thank you so much, Dr. Xochitl, for your time. We love you here at Ezra Wellness. I know you'll be coming back again. Thank you for your time. It's always a pleasure. Thank you for coming.
Thank you.
Yeah, and thank you guys for watching this video. Until we see you in the next video, remember, this is Ezra Wellness, where you learn proven ways to healthy living. Thank you for your time.